Hello, my name is Dr. Larry Salata, and I want to talk to you today about how to save money on your dental treatment. For starters, if you have recently endured some difficult financial situation, you may find it necessary to visit a free or reduced price clinic which could help you with dental emergencies. In Stark County, those clinics are the Stark County Health Department and Mercy Medical Center Dental Clinic. In addition, there are a couple of programs through the state of Ohio which can help you. One is the Ohio Dental Options and another is the Ohio Medicaid program. You can find the numbers for these programs in the phone book or through the Stark County Dental Society, or call my office and we'd be glad to get you headed in the right direction. Beyond that, if you are a paying patient or utilizing a work benefit, then it is mostly up to you to be a smart consumer. Saving money comes in two areas. The first is to exercise good preventative dentistry to avoid costly treatments down the road. And the second is to make wise decisions on where and by whom you accept your dental treatment from. It is no surprise that I am hoping that you will become a patient in my office, and I believe that it will be a smart financial decision for you to do that. Preventative dentistry will save you money in the long run. Examinations and radiographs will help to find problems early on which can be treated easier and at a lower cost of advanced dental problems. I often find cavities on patients by use of radiographs that are not visible by just looking, and the patient has no feel or sense of the problem. If you think, well, nothing bothers me, so I must be okay, you may be wrong. Often by the time you feel a toothache, your nerve is injured and you will require a root canal or extraction. In addition to the cost of treatment, if you experience a swelling or toothache, then you may end up missing work to remedy the situation at hand, and that will cost you more money also. So don't try to skip out on examinations and dental radiographs. They are the best spent money in dentistry. Now here's the flip side of preventative dentistry. If the dentist tells you that there is a problem or that you need a lot of work, and this seems to be a big surprise to you, then you need to ask to be shown the problem. Any good dentist will be able to show you the problem on a radiograph or use a small camera that fits into your mouth and show you the problem on a monitor so that you can easily see and understand your problem. If the dentist will not do that or is unable to do that, then you should go somewhere else for another opinion. In my office, I routinely show the radiographs to the patient and use the intraoral camera so that you can clearly understand the problem and we can start considering options to take care of that. So again, preventative dentistry will save you money, but you have to be careful about who you choose to go to. Here are some of the issues you should look at in choosing a dentist. First, there is no free lunch. Any attempt to offer you something free is obviously an attempt to get the greatest number of people into the office to present a treatment plan. And once beyond the free offer, there are no restrictions or regulations on what a dentist could charge for a given treatment procedure. And we find in dentistry a huge variation in what dentists do propose for treatment and also what they charge for different treatments. So free offers get you in the door, but beyond that it is totally buyer beware. If you find it necessary to accept the free offer, ask the next question, such as, what is the fee for a common dental procedure that you think you might need? Then call several offices and see what that fee is. Or also be aware of the add-on to that free dental visit, such as dental irrigation, oral hygiene tools, or other items you are pressured to buy as a result of accepting their free offer. In my over 20 years of practice, I have seen many of the tricks the dental offices will use to inflate their fee to you. Here are a few. First, the add-ons. You may be quoted a fee on a procedure, but when you get to the checkout desk, you are presented with a much higher fee because the dentist had to perform additional procedures that you never knew about. An example is the treatment of a crown. You may be quoted a fee on a crown, but in the end, the dentist may state that you also needed a crown buildup and crown lengthening and add on several $100s onto the fee of your crown. You are never informed of those charges until you are standing at the front desk in front of people and at risk to appear as a problem patient. Now, sometimes these procedures are necessary, but if you were not informed of these ahead of time or even during the procedure, then you will be surprised with your final fee. and it seems that some dentists add on these fees on every crown procedure they do, so be careful of that. Do not ever be treated without finding out the cost of the treatment, and do not ever be treated without having the treatment plan written down and presented to you. And be sure to ask, are these the total fees? Presenting written treatment plans is something I always do. I will present the treatment plan to you in writing and stick to it. If a treatment has the potential to have additional procedures, I will list those and inform you of the possibility of those procedures. Next is the problem of overdiagnosis and overtreatment. If you think it just isn't making sense, get out and get another opinion. I've seen many printed treatment plans from other offices proposing work that just was not necessary, and the pricing on the treatment was unreasonable. I hate to say it, but there is a high advertising, highly visible, large retail type office that is dropping large and excessive treatment plans on people that are just entirely out of line. Please get another opinion if it just doesn't seem right, and they will not explain to you the problem and options. I know it takes more time and the hassle of another visit and examination, but it can literally save you thousands of dollars. Next is the option of treatment given to you. At times, a dentist will only offer the best high-end treatment to you and act like that is the only option available, when in reality there are usually different options available with different prices. Now granted, we all would like to do the best and longest lasting treatment for all of our patients all of the time. But the reality is that not all patients can do that all of the time, and the dentist should offer you alternative treatments if you should so desire. I have numerous times treated a patient with a lower cost option that may not last as long, and they have totally understood that and also greatly appreciated that. Be aware of the financing options that are often presented to patients. At times, these are useful and necessary to help you out of an urgent situation, but sometimes they are a sales pitch to get you to sign on to a treatment that you just cannot afford. The presentation of dental treatment is subject to the techniques of sales pitches, just like any other product or service you might need or want. If a dentist makes you feel like you are inadequate, such as you don't look good enough to meet that someone special, or to get that job, he is playing on your emotional needs and will try to get you to accept treatment for appearance. Now that is one of the great things we do in dentistry, and I perform smile enhancements as well. But it is up to you to decide what is best for you and not for a dentist to lay a guilt trip on you. So be careful of that. So in summary, to save money on your dental treatment, it is up to you to be a good consumer. Be careful about where you go and try to get a reference from someone you know. Get your treatment plan written on paper and observe it before accepting treatment. Ask if this is the total charge for the treatment you need. Ask if there are other alternative treatments at lower cost. For elective treatment, be sure it is what you desire and not that you are pressured into feeling inadequate. Be aware that there is no free lunch and that huge advertising campaigns cost a lot of money, and that money must be remade somewhere. Finally, if you come to me, I will show you clearly what problems are there, and I will be upfront about your treatment needs. I will give written treatment plans and will offer alternative treatment options if available. And I do not ever hard sell or pressure anyone to accept treatment. My name is Dr. Larry Salata, and I hope this has been helpful.